Getting that feedback is very important as a new Psych NP because we're worried about, are we being safe? Are we doing harm to somebody? And so being able to think through a case is super helpful and get feedback from experienced clinicians and learn from other experts, which I bring in other experts and they lecture on their areas of expertise.
Hi, this is Tim Westbrook. Welcome to I Love Being Sober. We talk about life and recovery, mental health, biohacking, alternative therapies, and everything related to living a kick-ass sober life. So let's dig in.
Welcome to I Love Being Sober. I am here with Dr. Lindsay Hill. So excited to have this conversation with you today. Today's guest is a powerhouse in the world of psychiatric mental health, a PMHNP, also AKA a nurse practitioner, an educator, and an entrepreneur. She holds a Doctor of Nursing practice with a specialization in DBT and is passionate about empowering clinicians while transforming how psychiatric care is delivered. She's the founder of the PsychNP Bootcamp, which has helped hundreds of nurse practitioners gain clinical clarity and confidence, and the co-founder of the PsychNP Network, a thriving community for psychiatric NPs across the country. As president of the APNA Arizona chapter, she's a leading voice in advancing innovation, advocacy, and collaboration in mental health. She's also bridging clinical practice with cutting-edge technology through her work as an AI healthcare consultant, helping organizations use tools like artificial intelligence to improve workflows and outcomes. Dr. Hill, welcome to the show. I'm so glad to have you here.
Thanks for having me, Tim. I'm excited to be here.
Yeah, so we're going to talk about a lot. And
Great.
Specifically, I'm excited to talk about your work as an AI healthcare consultant. And as we mentioned earlier, so artificial intelligence is not going to take your job. People that are using AI are going to take your job.
Yep.
And I'm sure that's your experience as well. You're nodding, so you're like, yeah.
100%.
100%.
Yeah, you have to figure out how to leverage it at this point, I think.
Yeah, so we're going to get into that, amongst other things, in this conversation. So
Great.
So first, let's just start with your journey.
Yeah.
What inspired you to become a Psych NP and eventually launch your own ventures?
Yeah, so I, first of all, have dealt personally with my own mental health struggles. I've had family members and friends who have dealt with their mental health struggles. And, you know, I've always saw myself in a helping profession, but I never thought that I would work in psychiatric nursing per se, because I did my clinical rotation in Dayton, Ohio, inpatient unit.
Are you from Ohio? Mm-hmm. Okay.
Mm-hmm. Are you?
I am not. I'm from Southern California.
Okay.
But I was just, so you're from Ohio. You grew up in Ohio?
Washington State and Ohio. Yep. Mm-hmm.
Okay. And then when did your mental health, tell me about your mental health struggles.
They started in high school, really. That's when I was first diagnosed with ADHD. I mean, I struggled before that, but with the academic load, I got more overwhelmed and I had a harder time with things that it seemed like other people weren't struggling with as much. And I felt like, why is this so much harder for me?
Okay.
If that makes sense. And yeah, it was tough. But I also was dealing with just people close to me struggling on heavier levels with their mental health. And that was also very hard. But I never even knew about what a psychiatric nurse practitioner was in Ohio. I'd never even heard of that role until I relocated to Arizona, and I was working at Arizona State University. And
what brought you to Arizona?
Really, my parents were moving back out here to be close to their parents who were getting older. Okay. And where I was from was a very small town, 2 stoplights. I was ready to expand my horizons.
Okay.
Because I'd gone to high school there. I went to my undergrad in nursing there in that small town. And so I was ready to kind of spread my wings. But when I got here, I didn't have connections and I was a new grad and I had a very hard time even finding that first nursing job. So that was stressful. But lo and behold, I met somebody on Craigslist buying a couch that connected me with this job opportunity at Arizona State University as a community health nurse.
Awesome. Okay.
So that was crazy, but really cool. And it was there that I saw a new side of mental health where I saw ASU students who were not functioning. Some of them were almost dropping out of school, really distressed. Go from that to being able to live purposeful lives. And I just kind of instantly knew like that's what I wanted to do. So I just would, try to learn as much as I could from those 2 Psych NPs. I just loved everything about the role. So I kind of knew it was for me. And thankfully I was able to go back to school after just a year and a half of working as a community health nurse. So it was sooner than I would have anticipated, but the opportunity presented itself and it worked out. So I'm glad that I did it. Yeah. But it's been a whirlwind.
What do they say? Success happens if a person is prepared when opportunity knocks. So it's kind of like you did all these other things. The door opened to become a Psych NP or to go down that path presented itself, and you were ready.
Exactly.
And you took that step.
Exactly. And I had a mentor at the time who was very much like, where do you want to be in 5 years from now? And, kind of helping me think ahead, even though I was having imposter syndrome and, just trying to get through that first job. Right. But I appreciated that, like in retrospect, that I had somebody who was really thinking ahead for me too, as far as my goals. So.
Okay. Awesome. Cool. So you specialize in DBT. How has that shaped your approach to clinical care and clinical education?
Yeah, great question. So I had this really unique opportunity in Psych NP school, actually at the Phoenix Indian Medical Center, which is pretty close.
Okay.
And they came to me, they said, oh, you could help co-lead these DBT skill groups. And I thought, oh, that's really interesting because I really want to incorporate psychotherapy into what I'm doing when I graduate. So I just thought that I would be leading these skills groups off the bat. Well, they were like, no, you're going to be going through it as a participant. And this was with like adolescents who were, chronically self-harming and dealing with pretty big mental health struggles. And so I kind of was like, yeah, I'm pretty functional. Like, what am I really going to get out of this? I was skeptical.
Okay.
And then I realized that really there was a lot of work that I needed to do in terms of like uncomfortable emotions. And it was just a transformative experience for me. Okay. And it just really got me thinking about like, why didn't I know about these coping skills sooner? Like, why aren't we teaching this stuff in schools? It just really just made me think differently about mental health and a passion about, wanting kids, adolescents too, to have more of these coping skills earlier so that we're not waiting until people are sick and then they go get mental health treatment, more of that like preventative approach. So anyway, it's just helped me on a personal level a lot in terms of, when we are more stressed out, dealing with mental health issues, we tend to get more black and white, more rigid, and that can be not a great thing. And so being able to kind of find that middle ground, that wise mind, that two things can be true, has been super helpful for both my clients and myself. So
okay. So let's talk about actually, you know what? I want to talk about TMS first. So
yeah.
So you're doing TMS here at Camelback Recovery, Camelback Integrated Health and Wellness.
Yeah.
What happened in your life that made you think I want to try out TMS?
Yeah, I had a traumatic brain injury in 2021 or 2022.
Okay.
And it was a ski accident, and my memory, my cognition has never been the same. I experienced a lot of even personality changes, just more irritability. It was a difficult time. And it was shortly after that I got really burned out in my role as a Psych NP. Okay. And I was just like tapped out on kind of helping people. Yeah. I felt like I really needed to kind of take care of myself. And since then I've done different things for my mental health. I do take psychiatric medications. I've done therapy. So I am, invested in taking a holistic approach to my mental health. That being said, though, ideally, I would like my memory and my recall, and I'd love to be back to my baseline at some point. I don't know if it's in the cards for me or not, but I've never been back to that point, and it really it's made me more empathetic to people who deal with traumatic brain injuries, significantly more empathetic because I think I took that for granted, just being able to remember things, be sharp, think on the spot. And now I'll have moments where I'll just totally lose my train of thought in the middle of talking about something.
I can relate. I had a traumatic brain injury as well.
Oh, really? I didn't know that.
It was a long time ago. It was 1996.
Oh, wow.
But it took me, I wasn't the same person on the other end. It was a major car accident. I don't remember anything for 2 weeks of my life. It probably took me 2 years to recover. But after that accident, to your point, my memory wasn't as good as it was prior to the accident. It took me a long time to recover. Like I said, a couple years. Yeah. And I wasn't the same person. So so I'm empathetic to it, and it's a big deal.
Absolutely. Yeah. So
so go ahead.
So I would say, just wanting to continually improve my mood, and then maybe be able to taper back on some of my medications. I thought, because I've been hearing other people being able to do that once they started in TMS. So I just really felt like this is a really cool intervention, and I've been wanting to learn more about it and do it for several years. I actually took a job because I thought that I was going to be able to have that opportunity, and then there was billing issues and coverage issues, and so they didn't end up offering that service line. And I was super bummed. So I was very grateful for the opportunity to do it here at Camelback Integrated.
Now, so TMS is FDA cleared for OCD, smoking cessation, and depression. However, what made, because my experience is that it helps for cognition. It helps for so many other things. And you decided, what made you decide, okay, I think this is going to work for me?
Looking at the research and the potential, even though it's not FDA cleared for, exactly my psychiatric conditions, we use a lot of things off label in psychiatry. Right. And so just looking at the modality, how it works, I felt like there is definitely room for improvement. And it's been really specific, the things that I've noticed an improvement with. I think I was telling you the other day, rumination. Rumination, something that's improved significantly for me, because now I'm 61 sessions in. So, and that's been great. Also, my concentration has improved because, I know this because I'm reading a lot more, and I'm able to sit there for extended periods of time and read. And that's not always been the case since my brain injury.
Yes.
So I've been cautiously optimistic, but I'm really happy that I did it, and that, it's pretty cool.
And have there been any side effects?
No. There was one day that my neck felt a little bit muscle achy, but I don't even know if it was that. So really, no, there hasn't been side effects. In
your experience, who would benefit from TMS?
I think a lot of people could benefit from TMS, honestly. I feel like I love the how some people describe it as far as going to the gym for your brain or physical therapy for your brain. I think that the more that we learn about mental health, it's there's so many interrelated aspects that I really think a large population of people could benefit from this intervention. Right. And so I'm hopeful for kind of how it advances in the future in terms of being able to offer it to more people, right? Because coverage can be an issue, and getting it paid for. But I really see this huge potential, especially even in adolescent population, potentially, to have more non-medication options to help them is pretty huge. Yeah. Because it's hard these days. It's hard, and I think a lot of people they start self-medicating, or they turn to unhealthy coping skills pretty young sometimes. So I think just having more options out there that aren't just psychiatric medication is pretty. I'm very excited to see the future of TMS.
Any reason someone should not try out TMS? from your perception?
From my understanding, if they've had a history of a seizure, then they might not be the best fit for TMS.
Right.
But I'm still learning more about like using it with individuals who have been diagnosed with bipolar disorder, and it seems like it's not completely like a contraindication if there's certain aspects on board. So I'm still like in the research, like in the weeds. Right. I ordered like the APA 2025 TMS book, and I'm really nerding out. But I really think I have, for treatment-resistant OCD too, I have some patients that I'm like very hopeful for, because it is, it gets you down when you feel like you can't make any more progress with a patient and you really want to help them and they're still really distressed and you've kind of maxed out on other options.
Right. So you're 61 sessions in. When did you start to notice a difference?
It was right about like I feel like around the 33rd session.
Okay.
Because I remember my husband said, like, man, that stinks that like insurance most of the time covers 36 sessions, because I feel like you're just now starting to see this like therapeutic benefit. And I'm like, I know, you're right.
Right.
So yeah, I would say it was around then that I really started noticing more of a significant difference.
And then since then, how much of a difference have you, like how much more of a difference have you noticed?
Quite a bit. I would say like PMDD, premenstrual dysphoric disorder, something else that I've dealt with.
Okay. And
so that was a lot more like feeling stable during that time.
Right.
And sometimes, we use SSRIs during that time. So we'll use them sometimes just during the luteal phase for that, or we'll use a higher dose. And I wasn't needing to use that like extra dose of sertraline that I sometimes use.
Okay.
So that was a great indication. So yeah, I've been really pleased with the outcomes, and I'm hopeful to be able to get more people connected with that treatment to get better, because our meds only do so much.
Right. Yeah. I just love that there's no side effects. You can drive to the clinic, you can drive home, and it's non-invasive. It's just like, there's no reason not to give it a shot.
Yeah. Right.
Yeah.
It's pretty incredible.
Yep. Okay. Let's talk about your nurse practitioner bootcamp.
Okay.
So you've supported so many nurse practitioners. So tell me about your program. What's involved? How's it work?
Yeah. Well, the way that it got started, because I feel like giving some context helps.
And I guess even before you start talking about that, why are you so passionate about this boot camp?
Yeah, great question. I have always loved like precepting. So I've always had a student usually with me as I'm delivering care that I learn from them, they learn from me. Yep. Like it's a really just like fulfilling collaborative experience. And then when I kind of broke off and did my own business, I wasn't precepting as much and I really missed that aspect. So I decided to go on social media and kind of and talk about being a Psych NP. And it seemed like the people who were really drawn to my content were other Psych NP students or new grads, like other providers. And so I kept hearing kind of like the same problems from them as far as not feeling prepared after school, having a hard time finding quality preceptorships, difficulty with the quality of their Psych NP education, that type of thing. And so I ended up putting together an offering kind of based on hearing these repeat complaints. And it's since then really just evolved. And it feels like it evolves all the time because I'm constantly seeking feedback from the people who go through it. And it fills a very important need, not that it's like the solution because it's a bigger systemic issue. But I think it helps to provide more resources because it's a very also like lonely and isolating feeling to be new and to have that imposter syndrome and to not feel like you have support is not a good way to feel. And also a lot of people end up not continuing their careers as Psych NPs because they're like, that was too heavy. I think I'm good. I'm fine. Just like what I was doing is great. So we need more people to be providing mental health services. And nurses tend to be more like holistic and integrative, which I think has really cool potential. But we still need to have good mentorship, and we don't get a residency like psychiatrists get.
Right.
Yeah.
Right. That seems like it could be an issue.
Yeah, it is.
And how long ago when did you start the boot camp?
I want to say 3 years ago, I think, or 2.5 years ago. So yeah, quite a while ago.
How long is the program?
The program is technically 12 weeks, but the thing is people get indefinite access to my community. So I've had people who have been in it from the beginning who still come to the live coaching and take advantage of the mentorship support. So it is approved for continuing ed, which can be a great benefit, especially if an employer will cover that cost. A lot of the people who go through it will talk to their employers and say, hey, I really want to do this transition to practice program, get additional support. Is this something you would consider reimbursing?
Yeah.
Which is pretty awesome. So
Right.
I've connected with so many amazing Psych NPs across the country through it. And it's really given me this greater sense of belonging, community, purpose. So it's been great.
And what are the benefits of going through your program?
The benefits are having personalized mentorship, being able to attend the live coaching and bring up cases and receive that case consultation and feedback on our clinical reasoning. Getting that feedback is very important as a new Psych NP because we're worried about, are we being safe? Are we doing harm to somebody? And so being able to think through a case is super helpful and get feedback from experienced clinicians and learn from other experts, which I bring in other experts and they lecture on their areas of expertise. So that's huge. And then they connect with other Psych NPs. Networking is a huge aspect too, where it's led to like job opportunities for people where I'm like, ooh, you would be really great you need to meet this person.
Okay.
So I'm kind of like, I try to be that connector person.
So a little bit of a connection network as well?
Mm-hmm. Yeah, I would say so.
Okay.
And then there are people who are more experienced who have been through it who say that they're really happy they went through it as well because there is an element of professional development, and also if somebody's considered doing their own private practice, some support around that. So there have been a lot of people who have broke off from their corporate jobs and they're able to practice more in a way that align with their values. And it is nice to have that support and people kind of cheering you on when you decide to do something like that.
Who's a good candidate for your program?
A Psych NP student, a new grad, or an experienced Psych NP. And also family nurse practitioners have gone through the program who work a lot with patients who have mental health conditions. So that would be another. Also physician's assistants who work in psychiatry or work in general, family practice have also benefited from the boot camp.
Okay. Let's talk about social media. So social media, you've got your Instagram channel, you've got your TikTok channel. And how do you use those platforms to drive innovation or systems change in mental health care?
Great question. I try to provide helpful education. I really use it as a way to provide additional clinical education because the reality is people are using TikTok and Instagram like their search engines.
Right.
And so I think just providing valuable content that I'm getting good feedback on that, I've never heard it explained this way. In that practical fashion is definitely something that I try to do. As well as, again, trying to connect people. Like we're very siloed as nurse practitioners, and that's not good for your mental health. And so the more that I can, post other people on my stories, that eyeballs are on that, and then their practice, maybe I'll refer so-and-so. It's just kind of a ripple effect, the networking that can occur when you make yourself visible online, which really terrified me for the longest time. Okay. I just thought it was not for me.
And so you thought it was not for you. So why'd you change your mind? How did you dip your toe in the water?
I just would go live and my mom would be the only one watching and it'd be really awkward. But what prompted it? I think because I was starting a private practice. So I was like, originally that's how I started the page, was kind of like under the, it's going to be my private practice. And then it just didn't feel like me, And so then I changed my page from like being my private practice page to just like, I'm just me. And that was kind of like liberating in a way. And I don't know, it's kind of helped me with my nurse practitioner identity and kind of, because that's been, evolving over time for sure. So it was just one of those things where I was like, I want to try it out. I got very bored with because I was somebody who worked at Subway for 7 years. I would stay at jobs for really long periods of time just because I'm loyal and I liked that. I think it was an anxiety thing too of knowing what to expect. And so I kind of got to that point where I'm like, just take some risks. What's the worst that's going to happen? You hate it and okay, then you can go offline. You don't have to be on social media, but really it's led to the benefits far outweigh the downsides. Right.
I think being on social media, you can correct me if I'm wrong or let me know if you agree with this. It creates a level of accountability. So it's almost like it's like you have to be an example. You've got to follow through. You've got to do the next right thing because you've got a whole crowd of people that are watching you. What would you say about that?
Yeah, I think you're exactly right. And I think when you are more accountable, knowing that there are people who are looking at my platform who are struggling with their mental health and looking for ideas, to help, things that they can do to help their mental health. Obviously, I always clarify this isn't medical advice and you should have your own provider and things like that. But I still think that there are a lot of things that can be done earlier, earlier intervention and even risk factor identification, just education that can be out there that might change somebody's life, potentially, that they might not have known. And so that is motivating as well, for sure.
So you're also working at the intersection of AI and psychiatry. So what excites you most about how technology can support clinicians and patients?
I mean, we are inundated with the administrative burden often of insurance requirements and prior auths and documentation. And it's why I've left different jobs at points, because there's been points where I'm like, I really want to care for the patient and I feel like I'm more concerned about all this administrative stuff that I have to do because I don't want to lose my job. It feels like it's just, obviously.
Yeah, right.
But when it starts taking away from your ability to just care for the patient in front of you, it doesn't feel good ethically, because it's not why we went into the field, is to be more concerned about our documentation and our paperwork than the actual patient. So I think efficiency in terms of documentation is a big one for clinicians. I also think potentially more precision psychiatry, more individualized ability to look at somebody's different data points and provide them with better mental health care. I think it would really be ideal. We haven't really had the systems in place to do that. And it's hard when you have a caseload of 300 patients to really kind of get that overarching picture, of how they've progressed, when you're also putting out fires of whatever acute is going on in their life. So having different tools that we can leverage to look at the overall progression is really promising. So I'm hoping it can lead to better outcomes for patients and less burnout for clinicians and their ability to provide better patient care. So,
how much more effective are you as a PsychNP because of AI?
Much more effective. Much more effective.
Percentage wise. And I would imagine that you're more effective because you're able to spend more time with the patients, and then also you can more easily look at their data.
Yeah, I would say 80% more effective.
You're 80% more effective.
I feel like
that's
I am.
a lot.
I feel like I am.
I mean, I believe it.
I'm not a numbers person, Tim, but I don't know. That feels good.
Okay. You're 80% more effective, which means you're able to really you're able to help more people.
Yeah.
Essentially.
I mean, the fact that I can see a patient and not be worried about like the documentation piece right in that moment is huge, because you need that mental space to treatment plan and to put the pieces together. So yeah, just the more support that you have on that front, the better your treatment plan is going to be, the more comprehensive, more personalized.
And the documentation is mainly, those are mostly insurance requirements.
Right.
What are some of the biggest misconceptions about being a Psych NP that you wish more people understood?
It's a great question. I think who we are, what we do, is confusing for people, and I don't blame them. But I think, even in terms of our ability to provide psychotherapy, and there are several Psych NPs who get additional training in EMDR or different modalities and practice more of that. And I think that that's really misunderstood, that can be a part of our role and can lead to better outcomes. So that's another thing I'm passionate about, is showing more Psych NPs like, hey, there are different ways of practicing that might help more patients, that you might find more fulfilling, that's not just medication management.
Okay, good. And how do you maintain balance between clinical work, entrepreneurship, leadership, and innovation?
Yeah, I try to spend intentional time looking at, where my time's going, and what engagements I'm agreeing to, and are these aligning with what's important to me. And, if at the end of the day, I'm not spending quality time with my kids, then it's not worth it. You know what I mean? Like,
right.
I have to be prioritizing, obviously, my family. So it's not perfect. And I'm really passionate about what I do. And sometimes when you're really passionate about what you do, you can go down, and I have ADHD too. You can go down all these rabbit trails of like, you're learning and you're studying, and it's fun. But also sometimes I have to like rein it in a little bit and be like, okay, what are my goals for the week? Because I have more flexibility in my schedule to be able to do that. And that was the goal. I love that. And I still, have things to get done to reach my broader goals.
Right.
Yeah.
Right. So what advice would you give to Psych NPs who want to step into thought leadership or start their own program or their own business?
Great question. I would say, be seen. Don't be afraid to be visible. I think a lot of us want to kind of just be in the background and not stick out and not put ourselves out there. And I really, when I think about if I had been willing to put myself out there sooner in my career, because I've been a Psych NP for 10 years, I can't imagine the opportunities that I would have had if I wasn't so scared and kind of almost paralyzed to even think about doing that. I was a totally different mindset of going to conferences, even networking was not top of mind. And I didn't necessarily understand the value of it, I would say. So yeah, being visible, networking, being curious when you are meeting these networking connections, valuing relationships, I think can't be overstated. Right.
It's like my best thinking got me where I am today. So if I want to go somewhere else, I probably need to talk to somebody. It's like, I'm the average of the 5 people that I spend the most time with. And if I want to grow, if I want to expand, if I want to develop, I've got to reach out to some other people that are smarter, more successful, people that have what I want.
100%. And I think that can be tricky sometimes when there's not an exact blueprint of the thing that you're that's exactly what I want to be doing. When you kind of feel like you're kind of carving your own path. But I still think it's important to do what you're saying, even though it might look a little bit different, still seeking that feedback and being open to that, and being willing to pivot, and that's been something that was newer for me, just being willing to take these micro risks, I guess, and not so I have to stay in my anxiety bubble of what I know.
Right. Yeah, I love that you've been willing and open to go outside of your comfort zone. And I mean, that's obviously how you got to where you are today.
Yeah, it's pretty cool because I have social anxiety. And I like...
That's amazing. That's awesome.
Hated. I still don't love it. Like public speaking. Oh my gosh. I can't even tell you the level of anxiety that I would have in grad school. And I was actually thinking about this morning, like just how being on social media, how much that's helped, because I've done a little bit of public speaking more recently, and it feels different because I'm kind of mentally used to, like, even on live, you're kind of talking to people, and it's like, it's kind of almost like that exposure therapy. But yeah, I never would have imagined, if you would have told me 10 years ago, like, oh, you'll be doing, I'd be like, psh, that's funny.
Right. Yeah. And I can relate because I am not a natural public speaker. I'm not naturally good in front of big crowds and big groups, but I've done even going to AA meetings and sharing at meetings and sharing at the podium at meetings, like that has really helped me. And then I've completely transformed, and I'm able to speak in front of large groups and large audiences, and it's not a big deal. I was just thinking as you were talking, you said I'm not good in front of large groups, and I went to a Joe Dispenza retreat recently, and one of his examples, he talks about he invited somebody to go to one of his events, and they said, "Oh, I'm not a good learner. I have ADHD. I'm not a good learner." He said, "Oh, is that your affirmation?" And I was like, so it's like anytime I say anything like, I'm not good at climbing up hills. It's like, is that my affirmation? Oh, I'm not good at public speaking. I'm not good. And it really has caused me to think about things before I actually say them. Instead of saying I'm not good at public speaking, it's I'm getting better at public speaking.
Yeah.
So I completely, because it's kind of like whatever you believe, it's true.
Right. And also, you might have that automatic thought, and do you challenge it? Do you let that kind of stop you there? Or can you work through it and still put yourself out there, take that risk? I think there's a big difference there.
Right.
And I think that some people get stuck at the thought, right?
Yeah, totally. I mean, it's like if they believe they're not good at public speaking or climbing up hills or whatever, it's like you kind of got no chance. Right. And so being able to just face it head on has been helpful in my experience.
Yeah, I love that. That's cool.
For sure. Are there any questions that I didn't ask you that I should have asked you?
I don't think so.
Okay, let's talk about your morning routine. Tell me about your morning routine.
Morning routine is, honestly, I have a 5-year-old, and spending, like, doing a low dopamine morning where we're not on screens, where we're just engaging, we're playing, it's organic. Sometimes that means going in the pool.
Okay.
This
time of year, 5 a.m. is probably pretty nice to go into the pool.
Exactly.
Before the sun totally comes up.
Exactly. So just kind of being able to really treasure those special moments that I know won't be there forever is important to me. And so I tend to schedule my work in such a way, and my patients, where I can start a little bit later and really enjoy that time, and do some reading, just kind of ground myself for the day so that it's not like straight on my phone. And that's hard though. It's hard. It's a struggle. Like, we're a screen heavy society, and that's totally a struggle for me too, where I have to kind of reevaluate that screen time, especially in the morning, because it really changes the trajectory of my day.
Totally. How much time do you try to give yourself before you hop on the screen?
90 minutes.
Okay. That's solid. Okay.
Yeah, it doesn't. It's not. I'm not perfect at it. It's
at least
Yeah.
Because I mean, I think I would argue that most people, actually, I mean, not argue, but I think that most people hop on their phone first thing. Like, their phone is next to their bed, and they pick up their phone, and they're on Instagram or TikTok or whatever they look at, and it's just like right away.
Yeah, and I've certainly been in those habits before,
right?
And so I think just remembering, like, why I'm doing it, and being that example for my sons, and that's important.
So where can people find you? How can they learn more about your PsychNP Bootcamp? How can they connect with you?
Social media, my handles are PsychNP CEO.
Okay.
So they can find me on Instagram, TikTok, LinkedIn, and yeah, I'd love to connect with people and help in any way that I can in their journeys.
Okay, awesome. I think that pretty much brings us to the end of our show. Thank you so much for watching. And Lindsay, thank you so much for being here. I appreciate you. I appreciate your time.
Thanks for having me.
Yeah, awesome. And anybody that's watching, make sure you connect with Lindsay on Instagram or TikTok. And we will see you on the next episode.
Yeah, thanks for having me, Tim.
Thanks so much for listening to I Love Being Sober. I hope you got something valuable from today's episode. And if you're looking for more resources on recovery, mental health, or any of the therapies we talk about, head over to camelbackrecovery.com. You can find more episodes, blog posts, and ways to connect. Until next time, take care of yourself, keep growing, and keep living a kick-ass sober life.